does ERAS lead to enhanced quality outcomes is a very important question for clinicians, but of course also for manager, especially for the manager of medical direction. So I would like to thank the Congress Committee for inviting me to give the point of view of the manager. So ERAS has demonstrated major improvement in clinical practice, as shown on the website of ERAS Society, mentioned a few minutes ago by Ole Lundqvist. Wonderful result has been shown by the pathway and the program, such as length of stay decreased for almost 30%, and of course post-operative complication by up to 50%. So the question is, does ERAS improve other domains than clinical practice? First of all, how is ERAS disseminated within the CHUV, which is a university hospital in the French part of Switzerland, along the Lake Léman, Geneva Lake, in Switzerland. ERAS program launched progressively since 2011 in 3 different surgical disciplines for almost 9 interventions. And it is, since 2011, about 700 patients are included in the ERAS program. Most of them are of visceral surgery under the dynamic leadership of Professor Nicolas de Martine, and 13% under the governance of Professor Zinslitsky. The number of staff members working daily with ERAS are about 70 physicians and more than 180 nurses and allied health workers. So that means that it concerned about 30 to 50% of the surgical department. So we have still work in progress to launch ERAS program in other disciplines, but we can see that we acquired a lot of experience with ERAS. So which impact is the impact of ERAS on the clinical indicators, especially in the domain of quality and safety? I'm going to show you results of 7 clinical indicators. Some of them are very recently launched in the management dashboard of the CHUV. We have 5 domains of clinical indicators: delay, for example, length of stay, patient participation, of course, complications. Also, the domain is safety, is very crucial for the medical direction, and some indicators about teamwork and satisfaction. The dashboard is a masterpiece of CHUV board management. It's not an illusion. It's really used in the management of the hospital. We have 30 indicators. Some are for financial resources, for example, human resources, clinical, and so on. It enabled monitoring of the activity of hospital, also to which extent are the strategic goals achieved, and it's reviewed every 3 months between the board of direction and the direction of department. And those indicators are based on transparency and, of course, on accountability, and they are visible for every employee in the intranet of the hospital. So in the delay domain, we highlight a decrease of length of stay in the ERAS group, which reached about 20% between 2011 and 2013, and it included elective surgery and also emergency surgery. And we see that this decrease is higher than the other patients whom we also have a decrease of the length of stay, because our hospital is under pressure, like every hospital in the world, to decrease length of stay. The delay to transmit the discharge summary to the GP when the patient go back home is also an important indicator, because it highlights the quality of the transition between hospital and home. And in Lausanne, in the CHUV, we have a goal to send this discharge summary in the 8 days following the discharge day. And what we see with the ERAS group, that until now, we do not have improvement of timeliness of discharge summary with ERAS. It is probably due, I do not have a definitive explanation, but it's probably due that the ERAS group concentrate the oncological patients, and we have to wait for the pathological report to write the discharge summary, and it's a reason why we have some extra delays to get the pathological report. The rate of potentially avoidable readmissions, that means that our readmissions within the 30 days after discharge due to the at least one diagnosis which were present at the index hospitalization and for unplanned readmission. It's a very important indicator because it's a national indicator, and what is very interesting is that in the ERAS group, after adjustment for risk, we see that the rate is lower than without the ERAS program for other patients. And what is also very important, that the rate is within the ERAS group is within the confidence interval, while without ERAS we are up the confidence interval. In the domain of safety, as every hospital, we use the safety WHO checklist for a safer care, and we see also that with ERAS we have a better completeness of the team time out just before incision than without the ERAS group, and this is probably due to the standardization of the process, but also to the better teamwork induced by ERAS. In the domain of patients' participation, we follow an indicator of the documentation of the informed consent, and we see that the informed consent is better documented in the ERAS group. For planned surgery, the difference is not so high, but for emergency, the difference is significant. You see it with the red part between 72.7 and 56.9%. So that's very promising results, because even in emergency, you can improve process indicators. For the global patient satisfactions, we don't have very tangible results because we didn't interview the patients of ERAS in a specific manner. So that means the ERAS group of patients is mixed with the general survey about satisfaction run every year in the hospital. But what we see is that on green with the cross, you see the general satisfaction for all the patients of the hospital. And we see a tendency to decrease the satisfaction. But in the visceral surgery, where we have the higher concentration of ERAS patients, we see that the satisfaction is more stable. So it's rather promising to have an improvement of patient satisfaction. Now, for teamwork and worker satisfaction, so far we didn't highlight evidence, objective evidence, that satisfaction at work has increased, but all the same we have interesting results. We have done a general survey for all the collaborators before the ERAS time and also very recently, that means last year. And what we see that generally we have a satisfaction in the hospital of staff member which decrease. And we have the same movement in the surgical department. But about the management staff, we can see that where it decrease, the satisfaction decrease for the whole hospital, it increase in the surgical department. So it gives sign that maybe something happens with better teamwork, better job satisfaction, and also something very promising related to the presentation of Valérie Ador. We know that the workload is completely correlated, is an important part of job satisfaction. So with the decrease, we can see with ERAS in some years, we will probably see a difference with the ERAS team. So in conclusion, I can say that from the management perspective, ERAS leads to enhanced quality outcomes. It has a positive impact on several domains of quality, safety, length of stay, readmission, potentially avoidable readmissions, or national indicator, informed consent, and to some extent for patient satisfaction. And for satisfaction at work, there is no demonstration, but many very positive feedbacks I hear when I visit the team, the ERAS team, that teamwork has improved. And we also see signs that the interdisciplinarity between anesthetists, between surgeons, but also between surgeons, physicians, nurses, has improved. And it's very important for the management. So ERAS enhance the quality governance and risk management, and for a manager, a medical or a deputy medical director, it's very interesting to reinforce teamwork, to reduce the variability in healthcare by standardization, to spread the evidence-based practice, and of course to outcomes of care, and to contribute to patients' empowerment. Therefore, if I would like to do the first guideline for the manager of an ERAS hospital, I would not recommend the food restriction that I know the anesthetists try to recommend in the perioperative and postoperative part of the stay, but I would recommend a great spread of ERAS fluid to enhance quality and safety policy. Thank you very much.